Today, let's talk about early effects of Ticagrelor versus Clopidogrel on peripheral endothelial function after non-ST elevation, acute coronary syndrome, and assessment of its relationship with coronary microvascular function. Peripheral endothelial dysfunction is an independent predictor of adverse long-term prognosis after acute coronary syndrome. Data are lacking on the effects of oral T2Y12 inhibitors on peripheral endothelial function in non-ST elevation acute coronary syndrome. Furthermore, the relation between peripheral endothelial function and invasive indexes of coronary microvascular function in non-ST elevation acute coronary syndrome is unclear. Between March 2018 and July 2020, hospitalized patients with non-ST elevation acute coronary syndrome were randomized to ticagrelor or clopidogrel. Peripheral endothelial function was assessed with brachial artery flow-mediated vasodilation. Invasive indexes of coronary microvascular function were obtained using an intracoronary pressure temperature sensor typed wire. In 70 patients included, mean age was 58.6 years, 78.6% were male, and 20% had diabetes mellitus. Compared with clopidogrel, ticagrelor significantly improved FMD after a median treatment time of 41.2 hours. The FMD was significantly correlated with the index of microcirculatory resistance measured in the infarct-related artery, with a stronger correlation found in those who did not have percutaneous coronary intervention. Using receiver operating characteristics curve analysis, an FMD of 8.2% identified an IMR of greater than 34 as the threshold, with 77.6% sensitivity and 52.4% specificity. In patients who did not have a percutaneous coronary intervention, an FMD of 11.49% identified an IMR of greater than 34 with 84.6% sensitivity and 80% specificity. To conclude, ticagrelor significantly improved peripheral endothelial function compared with clopidogrel in patients with non-ST elevation acute coronary syndrome. There was a significant correlation between brachial artery FMD and IMR of the infarct-related artery.